Hello everyone, a very good afternoon to all of you. Am I clearly visible, audible? Let me confirm if I'm live. I will start the class ahead. Give me a minute to confirm. So yes, I hope it is working. So I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I am here to take my series that is super simplified pathology. In this series, I'm going to decode entire Robbins in front of you in free YouTube lectures in a super simplified manner. So we have started general pathology. In general pathology, we have done many lectures on YouTube in the series Super Simplified Pathology. Currently, I am starting the most difficult topic, per se my knowledge, the most difficult topic from general pathology, that is neoplasia. So the most important question in neoplasia, what is the difference between benign and malignant tumors, the two type of tumors? I will come on that. Benign versus malignant tumors. It is a very important topic for university exams of second prof, MBBS students for the pathology, as well as MCQs. Many MCQs come from dysplasia, anaplasia. So what is dysplasia? What is anaplasia? How does they differ? What is the difference between benign and malignant tumors microscopically? What are the 10 features of the neoplasia? I will explain you everything. Don't worry. So let me start the lecture without wasting time. Let me start what is neoplasia. Before coming on the differences of the neoplasia, let me teach you what is neoplasia. Neo means new, plasia means growth. So basically neoplasia means new growth anywhere in the body. New growth anywhere in the body is known as neoplasia. The new growth which is formed is known as neoplasm. Neoplasm is also known as tumor. Neoplasia is the new growth, and the process is known as the new growth which is formed is known as neoplasm. Neoplasm is known as tumor. Now tumor is not always malignant. It is a misnomer, right? Tumor can be benign, can be malignant. Tumor can be of two types. It can be benign, it can be malignant. The branch of the science which deals with the study of the neoplasm is known as oncology. Now it is the most trending branch nowadays because the incidence and prevalence of malignancy or tumors is increasing drastically these days. These days, drastically, uh, the incidence and prevalence of the neoplasm is increasing. That's why oncology is a trending branch. Oncosurgeons, medical oncologists are there, right? Many of you maybe want to take oncology as a super specialization. Anyways, let me teach you what is neoplasm, how we define it. Can you see a normal cell in front of you? Of course, you all can see a normal cell in front of you. Can you see the DNA of the cells? Can you see the double-stranded DNA, nucleus of the cell? All normal cells of human body have growth receptor on them. Can you see a red color growth receptor on the cell? Of course, you can see the red color growth receptor on this cell, right? So all normal cells have growth receptor on them. When growth factor is coming, can you see the growth factor here in this diagram? This is the growth factor. When growth factor is, it is known as stimulus. When growth factor is coming, binding with the growth receptor, that it is giving the signal to the cell. That is when this cell is receiving the signal, then only this cell is dividing into two cells. It is undergoing mitosis and two daughter cells are formed. So this cell divides into two cells only when growth factor is coming. That is, the growth is under control. So whenever in my body the growth of any cell, the cell division, the mitosis is required, growth factor will give the signal to the cell, then only cell will divide. Otherwise, in absence of growth factor, in absence of stimulus, the cell do not divide. This is a normal cell. This is the story of the normal cell, right? What is a neoplastic cell? So this is the definition of neoplasia given in Robbins. It looks complicated. Yes or no? Let me split it. So if any complicated definition is there, just split into parts. Now this is the splitted definition. The same definition I have split it in 4 parts. Listen. So this is a neoplastic cell. Compare it with normal cell. Now what difference you can see here? In a neoplastic cell, you can see here there is absence of growth factor. There is absence of stimulus. Stimulus is absent, growth factor is absent. There is nothing on the growth receptor. Growth factor is not coming. There is no signal to this cell. Still, this cell is doing the mitosis and dividing into two cells. So one cell will form two cell, two cell will form four cell, four will form eight, eight will form 16, 16 will form 32. Likewise, a bunch of cells is formed. That is due to uncontrolled mitosis. Here the mitosis is uncontrolled and uncoordinated. Mitosis is uncontrolled and uncoordinated. It is not under physiological stimulus. The control of the mitosis is not under physiological control. Even in absence of growth factor. In absence of stimulus, the cell is dividing and a bunch of cell is formed, which is known as neoplasm. Now you tell me, what is the definition of neoplasm? It can occur in any part of the body from head to toe. It can occur in mouth, it can occur in gonads, uterus, ovary, everywhere it can occur, right? So what are neoplastic cell? Now you only tell me what is neoplastic cell. Neoplastic cell, a neoplasm is the mass of abnormal cell. Agree? It is a mass, it is the abnormal mass of the tissue in which the growth is exceeded. There is excessive growth and the growth is uncoordinated. So growth is exceeded, the growth is uncoordinated as that of normal tissue, and growth persists even after cessation of the stimulus. So growth factor is absent, the stimulus is absent, the signal is absent. Even after that, the growth is persisting. That makes a difference between the normal cell and a neoplastic cell. Give me a thumbs up if you got the definition. Now you will never forget the definition if you have seen this diagram. Give me a thumbs up. Hi Himanshu. So give me a thumbs up. You got the definition. This is a neoplastic cell. So let me come. So after definition, let me come on the components of the neoplasia. How many components are present in a neoplasia? In any neoplasm, there are two components, the parenchymal components and the stromal components. The parenchymal component and the stromal component. What is parenchyma? Parenchyma is the cells. The tumor cells are known as parenchyma. These are tumor cells which form the tumor. The tumor cells, actual tumor cells, are known as parenchyma, the parenchymal component. What is stroma? The background of the tumor cells is known as stroma. Can you see the background? In the background, blood vessels are present, lymphatics are present, lipid is present, fat is present, fibrous tissue is present. So everything is present in the background. So the background is known as stroma. So tumor cells are the main component, parenchymal component, and the supportive background, that is fibrous connective tissue and blood vessels in the background, constitute the stroma. There is a special term in the trauma I would like to tell you here, which comes in previous year question paper. In this diagram, can you see the tumor cells are, can you see all these are tumor cells? They are arranged in clusters. These are the small clusters of the tumor cells. In each cluster, please see the multiple tumor cells. So it is the parenchymal component. It is the parenchymal component. Appreciate the background, the light pink color background, which is showing fibrosis. This light pink color is showing fibrosis. That is stroma. Appreciated. The two components are appreciated. Now in the stroma, there is a special term on which MCQs come in your previous year question paper. What is desmoplasia? If the stroma is showing abundant fibrosis, abundant collagen stroma, if the collagen stroma, if the stroma, the background showing abundant collagen, that is abundant fibrosis, it is known as desmoplasia. See this diagram. Can you see the background in this diagram? Appreciate the background. Here tumor cells are less, the parenchymal component is less, but the background is more prominent. In the background, if you can notice, there is abundant of stroma. There is abundant of collagenous tissue or stroma. This term is known as desmoplasia. So what is the definition of desmoplasia? Desmoplasia is abundant collagen or fibrous tissue in the stroma. It occurs in few tumors. Desmoplasia is not a feature of all tumors. It occurs in few tumors like serous carcinoma of the breast. It occurs in aggressive tumors. So that is about the components. So till now we have studied the definition of the neoplasia. We know what is neoplasia. Neoplasia is a mass of abnormal cells in which the growth is uncoordinated, the growth is excessive, and growth occurs even after cessation of the stimuli. That is a neoplasia, right? After the definition, we have seen the two components of the neoplasia, the parenchymal component, the stromal component. In the stromal component, we have seen a special term. The special term is desmoplasia. Till now, that is the summary. Now coming on nomenclature of the neoplasia. As we know, tumors are of two types, benign and malignant. That is our today's lecture. Benign versus malignant tumors. That is our today's lecture. Give me a thumbs up. So that is let me teach you the nomenclature. If I give you the name of any tumor, looking at the name, can you identify whether it is a benign tumor or malignant? Yes, you can. So let me talk about the benign tumors first. All benign tumors in this world, all benign tumors in this world have a suffix oma, in the end. Have a suffix like adenoma. It is a benign tumor. See the suffix, it is oma. What is adi? Adi means glands. So it is a benign tumor of the glands. Benign tumor of the glands is known as adenoma. Let me come on papilloma. So let me show you adenoma first. Can you see? These are the glands. These are the circular glands with a lumen in the center. So these all are glands. These all are glands. And it is a benign tumor of gland. Benign tumor of gland, it is known as adi. Adi means gland. Adenoma. In the suffix oma means it is benign tumor. Right? The second is papilloma. This is papilloma. See the suffix. The suffix is oma. The suffix is oma. What do you mean by papilla? The papillae like finger-like projections. We have fingers. See the shape of the fingers. See the shape of the fingers. So finger-like projections are known as papillae. Papillae. See the tumor. See the tumor. The tumor is also finger-like projections. The shape of the tumor is like finger-like projections. That's why this tumor is known as papilloma. Papilloma. So these are two benign tumors examples I have told you. Many examples are there. So let me show you a few examples. In the benign tumor, you can see papilloma, squamous cell papilloma. See the suffix oma. Transitional cell papilloma. Liver cell adenoma. Right? See lipoma, fibroma, myxoma, chondroma, osteoma, synovioma, leiomyoma, rhabdomyoma, hemangioma, lymphangioma, meningioma. So see the suffix. It is oma. It is oma. So anything having oma, anything having oma in the suffix is benign. Give me a thumbs up. Everyone, jitne audience utni thumbs up. Fatafat. So anything, the summary is that anything having suffix oma is benign. There are 5 exceptions to this rule. There are 5 exceptions to this rule. So what are the exceptions? Examiner loves exception. Your MCQs comes on exception. Exception pe MCQ aate hain. So there are 5 exceptions. See, melanoma, seminoma, hepatoma, mesothelioma, and lymphoma. They also have oma in the suffix. Still, they are malignant. These 5 are the exceptions. They have oma in the suffix. Still, they are malignant. So melanoma is a malignant tumor of the skin. Seminoma is a malignant tumor of the testes. Hepatoma is a malignant tumor of the liver. Mesothelioma is a malignant tumor of the lung. And lymphoma is a malignant tumor of the lymph nodes. So they have oma in the suffix, but still they are malignant. They are not benign. That's why they are the exception to this rule. Give me a thumbs up. You got the exception? Now that was the nomenclature of benign tumor. Let me come on malignant tumors now. Let me come on malignant tumors. What does they have as a suffix? So there are 2 types of tumors in the world. The benign tumors and the malignant one. Benign tumors have suffix oma. O-M-A. Oma. It is a rule. There are 5 exceptions. You know the 5 exceptions. You know the 5 exceptions. So it is melanoma, mesothelioma, seminoma, hepatoma, and what was the last one? Lymphoma. So MMSHL. These are the 5 exceptions you have to learn. Now come on malignant tumors. What does they have in the suffix? In the suffix they have 2 things. Actually we have 2 types of epithelium in human body. In the human body we have 2 types of tissue actually. Human body is made up of either epithelial cells or mesenchymal cells. There are only 2 types. So our mucosa is made up of epithelium, squamous cell, columnar cell, and bone, muscle, cartilage, fat. That is mesenchyma. So in human 2 types of tissue are there: epithelial tissue, mesenchymal tissue, that we have studied in histology or embryology. Right? Now, if the tumor is arising from epithelial tissue, the suffix is carcinoma. In the end, you will have carcinoma. Not only oma, sirf oma nahi hai, complete carcinoma. And if the tumor is arising from mesenchyme, the suffix is sarcoma. The suffix is sarcoma. So carcinomas are the tumors of epithelium and sarcomas are the tumors of mesenchyma. Give me a thumbs up if you got this. Now the epithelium is of 2 types. We all know we have 2 types of epithelium: squamous epithelium and columnar epithelium. Columnar epithelium mean glands. Columnar का मतलब होता है glands, right? So here it is squamous cell carcinoma and here it is known as adenocarcinoma. So both have suffix carcinoma. Give me a thumbs up. So this I want to tell you. I have written this only. So you can see the 2 type of tissue in human body: mesenchymal and epithelial. If the tumor is mesenchymal in origin, the suffix is sarcoma. The suffix, I will show you the example. The suffix is sarcoma. And if the tumor is epithelial in origin, the suffix is carcinoma. The suffix is carcinoma. If it is squamous cell, it is squamous cell carcinoma. See the carcinoma. And if it is columnar, columnar means glands. Glands का मतलब होता है adeno. So it is adenocarcinoma. Adenocarcinoma. Give me a thumbs up. So what we have learned? So this is about the malignant. About the benign, there is only one thing. I have already told you benign means oma. Benign में तो सिर्फ एक ही चीज है. So what we have learned that tumors are of 2 types: benign, malignant. In benign only one thing is there. In malignant 2 things are there. So in benign only one thing is that the suffix is oma. With the 5 exceptions, we know the exceptions. Right? In malignant we have to see whether the tumor is arising from epithelium or whether the tumor is arising from mesenchyma. If it is arising from epithelium, the suffix is carcinoma. not oma, the complete carcinoma. And if the tumor is arising from mesenchyma, it is sarcoma. So we have one of the three suffix. In any tumor, we have one of the three suffix, either oma or carcinoma or sarcoma. If it is oma, it is benign. If it is carcinoma or sarcoma, it is malignant. That is the summary. I want thumbs up from everyone. Everyone means everyone. So Himanshu, Shreya Ghosh, and Z, everyone got it, and others also, those who are listening, they got it. What is the difference between benign? What is the difference in nomenclature in benign and malignant? Let me show you a few more examples. So can you see this is a sarcoma? It is arising from mesenchymal cells. Can you see this is the tumor of the gland. It is malignant tumor of the gland. Can you see the glands? It is adenocarcinoma and it is squamous cell carcinoma. You can see the two epithelial tumors. Now see the examples. See the examples. Everyone see the example. See the suffix squamous cell carcinoma, transitional cell carcinoma, adenocarcinoma, basal cell carcinoma, right? Choriocarcinoma. These all are examples. They have suffix carcinoma. These two are exceptions. Melanoma is having suffix oma. Hepatoma is having suffix oma. Still they are malignant. I have covered these two in exceptions. Give me a thumbs up. Few more examples. See, liposarcoma, fibrosarcoma, myxosarcoma, chondrosarcoma, osteosarcoma, synovial sarcoma, leiomyosarcoma, rhabdomyosarcoma, mesothelioma is an exception, angiosarcoma, lymphangiosarcoma, meningioma is an exception, right? Neurogenic sarcoma. So I have covered all that. So the suffix is either sarcoma or the suffix is either carcinoma. So these are epithelial tumors and these are mesenchymal tumors. See the benign form of them. So benign tumor of the adipose tissue is lipoma and malignant tumor of the adipose tissue is liposarcoma. Benign tumor of the fibrous tissue is fibroma. The malignant tumor is fibrosarcoma. Right? Myxoma, myxosarcoma. Chondroma, chondrosarcoma. Osteoma, osteosarcoma. Synovioma, synovial sarcoma. Leiomyoma, leiomyosarcoma. Rhabdomyoma, rhabdomyosarcoma. In the same way, you can continue the list. So benign versus malignant. You got the nomenclature. Everyone give me a thumbs up. I want to tell you one special category. Three special categories of the tumor. The first is the teratoma. Here I would like to cover teratoma. What is teratoma? Looking at the suffix, you will say, ma'am, the suffix is the oma, it should be benign. No, it is not the case. Again, it is an exception. Teratoma. No. You know, human body have many organs. So from head to toe, we all are made up of organs, right? All of our organs made up of one of the germ cell layer. Germ cell layer. There are three germ cell layers now. We have studied in embryology. There is endoderm, there is mesoderm, and there is ectoderm. These are the three germ cell layers. You may have studied in your childhood in embryology which organ develops from which germ cell layer. So brain, the CNS develops from ectoderm, the skin develops from ectoderm, the muscles develop from mesoderm, endoderm. So likewise, I don't remember, but each organ made up of the composition is of one of the germ cell layer. So whenever we have tumor of any organ, just suppose the tumor of the liver, the tumor of the brain, the tumor of the GIT, so that germ cell layer tumor is there. So either endodermal tumor or mesodermal or ectodermal. But there are some tumors which arise from totipotent cell. What do you mean by totipotent cell? Totipotent cells are the undifferentiated cell. They can develop into ectoderm as well as mesoderm as well as endoderm. If the tumor occurs in totipotent cell, tumor contains all three germ cell layer and such tumor is teratoma. Such tumor is teratoma. Give me a thumbs up. So see the definition. See what I have written in the definition. Normal tumors are composed of a single germ cell layer. If you talk about any tumor, liver tumor, kidney tumor, brain tumor, stomach tumor, GIT tumor, so they have single germ cell layer, either ectoderm or mesoderm or endoderm, one germ cell layer. But the tumor which is having all three germ cell layer, that is ecto, meso as well as endo, such tumor is known as teratoma. So these tumors are arising from totipotent cell. They arise from totipotent cell. Give me a thumbs up. So I want to say that teratoma is a tumor. Teratoma is a tumor which arises from totipotent cells. Since totipotent cells are undifferentiated cell, they can differentiate into ectoderm, mesoderm as well as endoderm. That's why teratoma contain all three germ cell layer. So inside teratoma, I can get any organ where they are present. Teratomas are basically found in the gonads. By gonads, I mean ovary in female and testes in the male, right? So they are either present in testes of the male or ovaries of the female. See the diagram of a teratoma. Now either it is a testes or a ovary, I can't say, but yeah, one of the gonad. Inside that, what you can see? You can see hairs. Can you see hairs in this? Yes, you can see hairs. You will say, ma'am, ovary के अंदर hair कहाँ से आया? Testes के अंदर hair कहाँ से आया? Yes, you can find anything inside, na? You can find hair. Can you see a teeth? We can find the teeth inside the ovary and testes. We can find the bone. We can find the cartilage. We can find the brain. We can find the skin. We can find anything. This is a tumor which contains literally anything. Literally it contains anything. Give me a thumbs up. So these are the diagrams. See, appreciate the hairs. Hairs देखते से समझ में आ जाता है, it is teratoma. It is teratoma. So that is one of the special category tumor. Two more things I would like to add here. These two are not neoplasm, but they look like neoplasm. They look like neoplasm. These two, so not actual tumors. So see the two terms now. Hamartoma has suffix oma and choriostoma also have suffix oma. So looking at the term, you will say, ma'am, are these benign tumor? You said that anything having oma is benign. So these both have oma. Are these benign tumor? No, these are not tumor at all. Neither benign nor malignant. These are something else. These are not actual tumors. Neither benign nor malignant. ना तो ये दोनों benign हैं, ना तो ये malignant हैं. ये कुछ और ही हैं. What are they? I will tell you. But learn. Teratoma में भी oma है, but it is not a tumor. It is not a benign tumor. It is a malignant tumor. It can be benign. It can be malignant both. Teratoma. It is a special category tumor having 3 germ cell layer. And hamartoma and choriostoma, these two are not tumors at all. So what are hamartoma? What are choriostoma? Okay. So hamartoma. What is hamartoma? It is abnormal tissue at normal site. The tissue is abnormal. The site is normal. And choriostoma is normal tissue at abnormal site. So tissue is normal, site is abnormal. What I am saying, I will explain you both. Don't worry. Give me a minute. So I am saying no, the spelling is wrong. I am saying hamar. What is the spelling? See the spelling. Okay, hamar. H-A-M-A-R. So I am saying hamartoma and choriostoma. Choriostoma. Hamartoma and choriostoma. So what I am saying in both of them, in hamartoma, the tissue is abnormal. The site is normal. And choriostoma, the tissue is normal, but the site is abnormal. Abnormal means the site is ectopic. The site is ectopic. Ectopic site is there. Here site is normal. That is the native site. That is the main site, native site or indigenous site for that tissue. Right? So that is the thing. Okay, let me explain you. Let me explain the both terminologies. Start with hamartoma. In the end, you will get it. Don't worry. Give me 2 minutes. Start with hamartoma. What is hamartoma? Okay, let me take an example. Can you see this is trachea? These are the 2 bronchi, right and left bronchi, and they are going in the lung. These are the 2 lungs in human. Now we know that trachea and bronchi have cartilaginous ring. The semicircular, the C-shaped cartilaginous rings are present here. Do you agree? So this cartilaginous ring is the normal finding of the trachea and the bronchi. So it is the normal site. They are present there usually. So that is their native site. So the cell of the cartilaginous ring, sometime these cells, the cells of the cartilage, sometimes they undergo focal malformation. And because of the focal, these are not neoplastic. They are not getting converted into cancer. Neither these are dysplastic nor they are anaplastic. Only they are arranged haphazardly. And that is the focal malformation. So it will form a mass, a haphazardly arranged mass there. So this mass is known as hamartoma. So what is the problem here? The site is normal. Normal also cartilage present at this site only, and now also it is present at this site. So the site is indigenous or native. Native means normal है. वहीं पे होना चाहिए और वहीं पे है. So native or indigenous site is there, but the tissue become abnormal. What is the abnormality in the tissue? The tissue become malformed. The tissue become haphazardly arranged. Give me a thumbs up. Everyone give me a thumbs up. So that is the definition of hamartoma. So now read the definition. What is hamartoma? It is focal developmental malformation. The tissue become disorganized, but it is mature. It is not malignant. Neither it is dysplastic nor it is anaplastic. No, it is mature. It is disorganized, mature tissue. And the site is normal. The site is native. Native मतलब normal site. जहाँ होना चाहिए वहीं है. Native है. So I am a native of India. So India is my normal native country, right? I am a resident of Indore. So Indore is my native place, right? So indigenous or native means normal. So the site is normal. The tissue become abnormal. Example is written in front of you. Hematoma of lung consists of mature cartilage. I have drawn the diagram, right? See other examples. Can you see it is a spleen? So this is a normal spleen. Inside the spleen we have red pulp and white pulp. If red pulp undergo disorganized, undergo haphazard arrangement, focal maldevelopment, so it is forming a hematoma. So red pulp normally present in spleen only. The only thing it become haphazard, it become focally malformed. So the site is normal. It is hematoma of the spleen. Now let me come on choriostoma. Okay, let me show you the example. See, what is it? What you can see in the example. The best example I can give you here. See what is there in the example. Everyone see. See, can you see a tongue? Yes, you can see a tongue. On the tongue, what you can see? This is thyroid. You will say, ma'am, what are you saying? Why thyroid is present on the tongue? We have thyroid, but in the neck. We all have thyroid in the neck. We don't have thyroid in the tongue. So if you cut this thyroid, it is absolutely normal thyroid. As it is present in the neck, the same thyroid is present. So the site is ectopic. The tissue is absolutely normal. It is not malformed. It is not haphazard. It is not disorganized. It is normal thyroid. The site is ectopic. The site is ectopic. It is not native. It is ectopic site. So normal tissue at abnormal site. One more example I would like. So it is a choriostoma. So one more example I would like to tell you here is GIT. Let me form the GIT. Sometimes inside the stomach or the intestine, we find pancreatic tissue. We find pancreatic masses. So it is absolutely normal pancreas. So it is present inside stomach or intestine. So the site is ectopic, abnormal site, but the tissue is normal. So it is known as choriostoma. So what is choriostoma? It is ectopic island of the normal tissue. Tissue is normal, the site is abnormal. It is also known as heterotopia. Heterotopia. So you can see pancreas inside the small intestine. You can see thyroid inside the tongue. I want thumbs up from everyone. So what are choriostoma and hematoma? Now you tell me. What is choriostoma? It is normal tissue at abnormal site, ectopic site. And what is hematoma? Abnormal tissue at normal site. No one will explain you with such simplicity. Have you got it? So we have two terminologies in front of us, choriostoma and hematoma. Choriostoma, the site is abnormal. It is ectopic. And hematoma, the tissue is abnormal. What is abnormal? Learn that. Otherwise you will get confused. Choriostoma में site abnormal है, वो ectopic है. और hematoma में tissue abnormal है, वो disorganized है. This is the best explanation I can give you. Everyone give me a thumbs up. Everyone. So till now, what we have learned? We have learned the definition of neoplasia. We have learned the components, the two type of components of neoplasia, parenchymal component and stromal component. We have learned the special category. No, we have learned the nomenclature. So benign tumors ends in oma with 5 exceptions. Malignant tumors end in either carcinoma or sarcoma depending whether they are arising from epithelial cells or mesenchymal cells. Right? We have learned some special category of the tumors. Teratoma, hematoma, choriostoma. You know everything. I guess you know everything. So I would like to learn some polls here. So Z is asking why hematoma and choriostoma are not put under malignant tumor category. Z, why I should put them in malignant tumor? Why? Tell me one reason why I should tell. They are not at all dysplastic. For malignancy, the tissue should be anaplastic. Anaplasia is the hallmark. I will tell you what is anaplasia. Anaplasia have 10 features. I will enumerate the 10 features. Any tissue having those 10 features is malignant. Otherwise, no one is malignant. Here, in hematoma, you can ask the question, ki, ma'am, it is a mass. Why you are not saying it is a malignancy? The mass is mature. The mass is mature. It is not anaplastic. And here, to yahan pe mass hai. But the site is abnormal, tissue is absolutely normal. Normal tissue ko I cannot call malignant tumor. If you make a slide of normal tissue and if you say make a slide of malignant tissue, the microscopic features are different. So here cells are not neoplastic cells, cancer cell. Here cells are normal. You got my answer? You got my answer? Z. Should I proceed ahead? So I would like to launch some polls here and you have to write your answer in the chat box. Please everyone participate. Everyone participate. It is an easy question. Tell me the carcinoma which arises from the gland. What is the name of that carcinoma? The 4 options are in front of you, A, B, C, D. Please write what is the correct answer. In this question, what is the correct answer? Please, you tell me. So, the tumor arising from the gland, is it basal cell carcinoma, squamous cell carcinoma, adenocarcinoma or fibrocarcinoma? So, Shreya, you are absolutely right. And Z, you are also absolutely right. What about others? I want everyone to participate. So glands means adeno. Adeno in English, the term is gland. And carcinoma is the tumor. So correct answer is C. It is adenocarcinoma. I have told you this, right? Correct answer is C. I want everyone to participate here. Come on, not only 2-3 students. This is the next question in front of you. Tumor containing cells of all three germ cell layer. A tumor which contains cells of all three germ cell layer. That tumor is known as. The four options are in front of you. Is it leiomyoma? Is it squamous cell carcinoma? Is it adenocarcinoma? Is it teratoma? What does that tumor called? I have told you very clearly. Yes, Z, you are right. Vinay Kashi, you are also right. What about others? Please write down your answer in the chat box. So what does that tumor known as? Yes, Shriya, very correct. So the correct answer here is teratoma. Teratoma is a tumor which arises from totipotent cells. Totipotent cells are the cells which can differentiate into any of the germ cell layer, ectoderm, mesoderm and endoderm. So teratoma contains all three germ cell layers. So correct answer here is D. I have told you this. So correct answer here is D. This is the next question in front of you. What is hamartoma? Define hamartoma. What is hamartoma? What is true about hamartoma? So what is true? Is it a malignant tumor? It is true. Is it a metastatic tumor? Is it true? Or is it a developmental malformation? Or it is hemorrhage? Hemorrhage in a blood vessel which is known as hamartoma. What is true about hamartoma? Who will tell me the correct answer among the four? What is the correct answer? Shriya, Vinay, Z. What is the correct answer? So hamartoma malignant tumor hai kya? No, hamartoma is not a tumor. Neither benign tumor nor metastatic tumor, not malignant tumor. Yes, it is not also hemorrhage. So you all are right. The correct answer is C. It is a developmental malformation in which the mature tissue become haphazard and disorganized. The tissue become disorganized. Very good. Very good. Have you got it? This is the next question in front of you. What is ectopic rest of normal tissue known as? So the tissue is normal, but the site is abnormal. It is ectopic. So normal tissue with ectopic site, what does it known as? Is it known as choriostoma? Is it known as hamartoma? Is it known as pseudotumor? Or is it known as lymphoma? Shriya, what does it known as? Z, Vinay, what does it known as? Himanshu, what does it known as? Please everyone participate. Yes. You are absolutely right. Noora, you are absolutely right. The correct answer here is A. It is choriostoma. So you can't believe how many questions come from hamartoma and choriostoma in your exam. It is a confusing topic. But now the concepts are crystal clear to you, right? The correct answer here is A. Very good. This is the next question. I have told you in the beginning. So everyone is right for the last question. Maverick, you are also right. So the correct answer, what is the correct answer here? Excessive fibrosis in a tumor. If the stroma have excessive fibrosis, the background have excessive fibrosis, does it known as anaplasia? Does it known as metaplasia? Does it known as desmoplasia? Or does it known as dysplasia? What does it known as? What does it known as? I have told you the tumors have two components, parenchymal component and stromal component. The stroma contains excessive fibrosis, sometimes in aggressive tumors. What does it known as? Yes, Shriya, you are absolutely right. The correct answer here is C. It is desmoplasia. So excessive fibrosis in the tumor is known as desmoplasia. Very good, very good. So can anyone define hamartoma? Yes, you all are right. Very good. I'm proud of you. You all are right. Very good. Now, come on, the next question. Can anyone of you define hamartoma? What is hamartoma? What is hamartoma? Read the four definitions. Tell me what is correct about hamartoma. Is it malignant condition? No, it is neither benign nor malignant. Is it an acquired condition? No, I will not go with this option. Now from A and B, what is correct? So Z is saying B. What about others? A and B में से क्या correct है? I'm asking to you. Is it proliferation of cells in the foreign site, or is it the native cells in that tissue? So what is correct? So it is the native, hamartoma is the native cells. Native matlab site is normal. Proliferation of the cell, it becomes haphazard. So correct answer is B. I'm changing the question. Yes, currently the correct answer is B and you all are right. Shriya, B, Vinay, you all are right. Hamartoma पूछूं तो answer B is correct. Hamartoma में Shriya is saying, I'm sorry. What you all are saying, answer B or A? What you are saying, answer is B or A? Here the answer is B. Why you all are saying A? You are saying A for this question. No. A is not the answer. Shriya, Vinay, A is not the answer. Answer is B. Hamartoma mein the site is native na. If I am asking the same question, what is choriostoma? Choriostoma ke liye answer A is correct. Choriostoma mein it is foreign site. So see the site, native site ki foreign site. Native site occurs in hamartoma. Foreign site occurs in choriostoma. You got my point? So if I say what is hamartoma, answer is B. If I'm saying what is choriostoma, answer is A. Everyone give me a thumbs up. Everyone. You realized your mistake. Those who are wrong specially. Yes, Purohit, you are right. Very good. Give me a thumbs up. So correct answer here is B. So depending what the examiner is asking, two questions can be created on this with the same four options. Give me a thumbs up. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. So let me come on the differences between benign and malignant tumor. That is my topic today. That is benign versus malignant tumor. Let me start benign versus malignant tumor. I will differentiate benign tumors from malignant tumors based on 5 features. Based on 5 features, I will differentiate them. First, I will see their rate of growth. So let me draw. This is benign. This is malignant. Let me tell you in short, then I will tell you the details of all points. Rate of growth. Usually, benign tumors are slow growing and malignant tumors are very fast growing. They are very fast growing. Benign tumors are slow growing. So if any patient is coming to your clinic, doctor, I am having a mass somewhere in the body. It can be in the breast, it can be in the bone, it can be anywhere. So doctor, I am having a mass. Mass is a tumor. So you have to explain the patient that there can be two type of masses, benign and malignant. So you have to tell me what is the growth. So since how much time you are noticing this mass. So if the patient is saying, I have noticed few days back or few months back and it is growing very rapidly, so more chances it is going to be malignant. It is going to be proven malignant, right? But if the patient is saying, no, it is present, doctor, since years, since 5 years, 10 years, and now I thought to take concern of it. So it is a slow growing. So it is going to be benign. So that is the first thing. That is the first thing, rate of the growth. And in the rate of the growth only, you have to ask for the doubling time. What do you mean by doubling time of a tumor? What do you mean by doubling time? So if the tumor is 1 centimeter, how much time is required to double the size? 2 centimeter. If the tumor is 2 centimeter, how much time is required to become 4 centimeter? So what is the time, doubling time? As I have told you, benign tumors are slow. So doubling time is more. Malignant tumors are fast. So doubling time is less. So try to ask the doubling time to the patient. So on the basis of the doubling time and rate of the growth, you can decide whether it is a benign tumor or malignant tumor. Give me a thumbs up. I will give you the details of all points. First, here are the differences. Number 1. Number 2, based on clinical features. Based on clinical features, you can differentiate benign and malignant tumor broadly, not exactly. So benign tumors are usually asymptomatic, usually, and malignant tumors are usually symptomatic. They produce pain, they produce ulceration, they will invade various parts, they show metastasis, they are symptomatic. But it is not always true. Now meningioma, you tell me what is meningioma? Meningioma, see the suffix. I'm asking for meningioma. Meningioma is having oma. Meningioma is oma in the suffix. So it is a benign tumor. Meningioma is a tumor of meninges of the brain. Even a single smallest meningioma can cause seizures. So although it is benign, but it can produce seizures, it can produce severe symptoms, right? So it is not always true that all benign tumors are asymptomatic and all malignant are symptomatic. Sometimes malignant can be silent and benign can produce symptom, reverse can happen. So it is not always true, but yeah, broadly this is the case. Give me a thumbs up. That is the second difference. That is the second difference. Okay, come on the third difference. That is based on gross. Gross means external. So you are a surgeon. You have taken the tumor out of the body. There is a patient in front of you. You have cut the tumor. You have taken it in a tray. You have done the surgery. So tumor is in your hand. It is in a tray. So you will see the shape, size, color, consistency of the tumor. Based on that, the gross features, can you give a guess that whether it is a benign tumor or malignant tumor? Yes. Benign tumors are usually spherical, they are usually circular, and they are well circumscribed, and they are covered with a capsule. They are usually covered with a capsule. And malignant tumors are irregular shape, they are haphazard, they don't have any fixed shape, and they are non-capsulated. So based on the gross, we can make a judgment. I will show you the diagrams. First, here are my points. So that is the third thing. That is the third thing. Now these all three are gases. So rate of growth can differ. Clinical features can differ, gross features can differ. So based on these, we are making a guess. We are not sure whether it is benign or malignant. That is only a guess. हम एक तुक्का मार रहे हैं कि benign होगा कि malignant, ज़्यादा chances किसके हैं? Confirm किस पे होगा? Who will do the confirmation? Who will do the confirmation? So confirmation will be done on the microscopy. So make a slide, do the biopsy or take a piece of the tumor and make a slide. In the slide, see the features in benign, see the features in malignant. There are 10 features. There are 10 features on microscopy. I will explain you all, which differentiate benign and malignant tumor. These 10 features are known as anaplasia. So anaplasia is present in malignant tumor and anaplasia is absent in benign tumor. That actually defines confirmatorily whether it is a benign tumor or malignant tumor. So to decide whether the tumor is benign or malignant, it is not a job of a surgeon. It is the job of a pathologist. So patients go to surgeon. Patient don't come to the pathologist. I am a pathologist. Patient don't come to me. So patient go to the surgeon, right? If they have any mass anywhere in the body, someone will refer them, go to the surgeon, he will operate you, she will operate you. So surgeons operate the tumor, but they don't know whether the tumor is benign or malignant, right? So imagine there is a patient in your clinic. She's a lady patient and she's having a mass in the breast. So breast cancer is the most common cancer in the world in the females. So either in right or left, she is having a mass in the breast. So you are a surgeon and this lady is coming to you, doctor, I'm having a breast mass. So you have to explain this patient that, madam, there can be two type of tumors. Now I don't know what is your case, but it can be benign, it can be malignant. But whatever it is, the only treatment is surgery. The only treatment is surgery. It will not resolve with any medicine. Whether it is benign, whether it is malignant, we have to take out of your body by doing the surgery. So she will say, okay, doctor, if it is the surgery is the only treatment for both of them, does it matter whether it is benign or malignant? You are saying same treatment for both. Does it matter? Yes, it matters. If it is benign, this will remain concise in breast only. It will not invade, it will not show metastasis. Benign tumors do not show invasion. It will not invade in the surrounding tissue, no. And it will not go to the distant tissue. No invasion, no metastasis. What is invasion? Invasion मतलब locally वहीं पे बढ़ना into the adjacent tissue. To that, benign tumors don't do that. Malignant tumors do that. So malignant tumors आस-पास में, from the breast they will go to the pectoralis muscle. From the pectoralis muscle they will move to the ribs. From the ribs they can move to the heart also. So malignant tumors invade to the surrounding tissue, adjacent surrounding tissue, but benign tumors do not invade. They remain concise to the organ where they are developed. So they will remain in breast only. They will not go to the ribs, heart, here, there, lung. They will not go to the adjacent tissue. They will not show invasion. Invasion is localized, adjacent tissue. What is metastasis? What is metastasis? Now this is the blood vessel of this lady. This is the blood vessel. So sometimes what happen? The tumor cells come to the blood vessel and via blood vessel they move to the various parts of the body. They can go to the brain, they can go to the lungs, they can go to the stomach, they can go to the ovaries, they can go to the bone, anywhere. So this patient have multiple tumor secondaries. These all are known as secondaries. The main tumor is the primary, which is present in the breast, and it is spreaded to various parts. So these are the secondaries which are discontinuous with the primary. So discontinuous secondary tumors, multiple secondary tumors are formed throughout the body. So both the features, this is known as metastasis. So invasion is the adjacent tissue and metastasis is the distant non-adjacent tissue, non-continuous tissue. इन दोनों में spread malignant tumor करता है, benign नहीं करता है. Benign tumor neither show invasion in the adjacent tissue nor show metastasis in the distant tissue. Both these features are of malignant tumor. So which are more dangerous, benign or malignant? So benign tumors are not dangerous at all. The only treatment is surgery. Just it will remain to the confined to that organ only, and surgically you just remove them. There is no fear. It will not spread throughout the body in multiple organs. But malignant tumors are very dangerous. They are very dreadful. They are very afraidful. You know, इनसे डरना चाहिए. Because जिस organ में है वहां तो होंगे ही. Locally आसपास भी जा सकते हैं और metastatically कहीं भी जा सकते हैं. They produce multiple secondary throughout the bodies. You cannot cut every part of the body now if it is spreading throughout the body. If malignant tumor spreaded to multiple organs, it is known as stage 4 tumor. Stage 4 tumor is a tumor which has already shown the metastasis. Have you got it? So what is the treatment of malignant tumor? Benign and malignant both. The first treatment is the surgery, take the tumor out. Number one, take the treatment out. Benign tumor, only treatment is surgery. The treatment is over. No more treatment is required. You have already done the surgery. But if it is metastatic tumor, after surgery, you have to give chemotherapy and radiotherapy also to the patient. Because you are not sure that whether this tumor already spreaded in the body. If it is already spreaded in the body, we will give chemotherapy to destroy the tumor cells in the blood and in various organs. We will give radiotherapy and chemotherapy to prevent metastasis in future. Give me a thumbs up. So if it is benign tumor, the only treatment is surgery. If it is malignant tumor, surgery followed by chemo followed by radio. This is the treatment. So it is useful to decide whether it is a benign tumor or whether it is a malignant tumor. We have to decide. If it is, because the treatment is different. Surgery is a common treatment, but after surgery, the radiotherapy and chemotherapy is given only in malignancy, not in benign. So treatment differs. Number one point is that the treatment of both is different. That's why we have to decide whether it is benign or malignant. Number two, prognosis also differ. Prognosis. So benign tumors have better prognosis, good prognosis. Once you have surgically removed them, they will never come back. But malignant tumors have poor prognosis. Once you have done the surgery, chemo, radio, even after that, they can come back. So the metastasis is the dreadful thing there. So that's why it is wiseful to always decide whether the tumor is benign or malignant. How you are going to do this? How you are a surgeon now. You just suppose you are a surgeon. So how you are going to do this? The patient has mass any part of the body. Let's take the same example of the breast. So how you are going to decide whether it is benign or malignant? So based on the features I have told you, you can make the guesses. You are a surgeon. Your job is to make the guess. The final will be told to you by the pathologist. So it is the job of the pathologist who will decide whether the tumor is benign or malignant. You ask the person rate of growth. Based on rate of growth, you make a guess whether it is benign or malignant, whether it is fast growing or slow growing. You ask the patient the symptoms. So based on symptoms, it can be benign, it can be malignant. So it is a rough guess. You are not sure. Based on the gross, you are the one who are going to operate the patient now. So in operation, take this tumor out in a tray, see the size, the shape, capsule present, absent, consistency. Based on that, you can make a guess whether it is benign or malignant. Now finally send it to the laboratory, and the pathologist will see microscopically. I will make the slide of it. In the slide, I will look for the 10 features. I will see these 10 features of anaplasia are present or absent. If they are present, it is malignant tumor. If they are absent, it is benign tumor. So it is the job of pathologist to decide whether the tumor is benign or malignant, and the report, it will be mentioned in the report. I will issue the report to the patient. I will not explain the report to the patient. I will just issue the report. Explaining the report to the patient, it's the job of a surgeon. So the patient will collect the report from the laboratory and go to the surgeon again. Patient के लिए surgeon ही doctor है, वो बोलेगा क्या है report में. So you have to tell the patient whether it is benign tumor or whether it is malignant based on those 10 features. I will mention the 10 features in my report. So based on that 10 features, you will explain your patient that your tumor is benign or malignant. In the local language the patient understand. The patient understand Hindi, Tamil, Marathi. You have to explain in that language that whether it is benign or malignant. If it is benign, surgery is the only treatment. We have already done it. No need to come back. You just go your home. The treatment is over. But if it is malignant tumor, you have to give chemotherapy to the patient, various sessions, various protocol depending what is the tumor. You have to give radiotherapy sessions, multiple sessions, 15, 30, various protocols are available. Various radiotherapies are available. And you have to keep close follow-up of the patient. Every 3 months, call the patient and do the investigation. Metastasis to nahi hua, look for metastasis. Do a close follow-up. So prognosis, you have to explain to the patient as well as to the family that prognosis can be poor. So that is the thing. Have you got it? Have you got it? So the next thing I want to explain you 10 features of anaplasia microscopically, which help me to decide whether the tumor is benign or malignant. The biggest difference between benign and malignant tumor is that the 2 points, local invasion and metastasis. Local invasion is invasion in the adjacent tissue. Metastasis is the invasion in the distant discontinuous tissue. Both of them are absent in benign, both of them are present in malignant. Everyone give me a thumbs up. Everyone. So Noora is asking, what is germ cell tumor? Noora, germ cell tumors are the tumors of the gonads. By gonads, I mean ovary in female and I mean testes in male. So females have ovaries and males have testes. In the gonads, ovaries and testes, we have germ cells. Germ cells. Germ cells are the cells which develop ova and sperm in the ovary and testes respectively. If tumor occurs in those germ cell, it is known as germ cell tumor. These are malignant tumors. Germ cell tumors are malignant tumors and they usually occurs in reproductive age, that is young age. So they usually occurs 20 to 40 years of age. So that is the usual age. So there are many types of tumors in the body. Currently I am teaching you generalized neoplasia. You got it, Noora? You got it? So anyways, everyone give me a thumbs up if I'm still visible, audible and you are awakened, you are not sleeping. So show your presence by giving your thumbs up that you are present physically as well as mentally with me. So you are not sleeping. So give me a thumbs up, come on. Should I continue the differences between benign versus malignant tumor? Have you got the overview? You're not giving the thumbs up. Let me see if I can see the chat, the updated chat. Okay, got it. Few students are still awakened. Great. Few are awakened. What about others? Anyways, okay, let me continue. So as I've told you, let me continue. Let me show you the three differences. Then I will come the main difference, that is microscopy. Microscopy is the main difference between benign and malignant. The 10 features I'm talking about again and again. So the first is the rate of growth. Malignant tumors are fast growing. They have less doubling time. And benign tumors are slow growing. They have high doubling time, right? That is the rate of growth. We have done the rate of growth. Based on clinical features, benign tumors are slow growing and they are asymptomatic, but rarely they can produce the serious symptoms like meningioma in the brain. So it is not always a rule. It is not always a rule. Have you got it? Malignant tumors are usually rapidly growing. So they ulcerate, they go to the deeper tissue, they show metastasis, they show weight loss, fever, anorexia, anemia. So they produce symptoms usually, but sometimes malignant tumor like in the prostate, it remains silent for years. Even the patient don't know that I'm having a malignant tumor. So this rule is not always valid that benign are asymptomatic, malignant are symptomatic. Usually it happens, but not always. So you can make a guess, but you cannot be sure 100%, right? So based on rate of growth, based on clinical features, the third is gross. Based on the gross, benign tumors and malignant tumors, right? Benign tumors are spherical or oval in shape. The malignant tumors are irregular in shape. Give me a thumbs up, right? The benign tumors are encapsulated and they are well circumscribed. The malignant tumors are poorly circumscribed, they are non-capsulated. Benign tumors are freely movable and the malignant tumors will extend to the adjacent tissue. Extend. So there is a word, compress and invade. Benign tumors compress the surrounding tissue. Malignant tumors invade that surrounding tissue. Let me take the example again, breast. Let me draw two breasts. This is a breast of a female. This is a breast of a female. And this is also a breast of a female, right? So let me draw two tumors in the breast. So let me draw, this is a tumor in the breast. This is a tumor. Just suppose this is benign tumor and this is malignant tumor in the breast. Benign tumor compress the surrounding tissue. Can you see this is the surrounding tissue? Just a second. Let me draw the surrounding tissue here. This is all surrounding tissue, normal tissue of the breast. With green color, I am drawing breast cell, the normal breast cell. And this is the surrounding tissue here. It is the normal tissue. So benign tumor, what I am saying, see my words. Benign tumor compress the surrounding tissue. So benign tumor, what will happen? The benign tumor will grow in size slowly, grow in size, grow in size. So it will compress. Compress यानी धकेलना. If you understand Hindi, it will धकेलेगा, वो आसपास के टिश्यू को compress करेगा. Compress means pushing. It will push the surrounding tissue so patient can feel a little bit pain. And due to the compression, that will compress. But malignant tumor will invade the surrounding tissue. It will not compress. वो तो घुस ही जाएगा उसके अंदर. Invade मतलब घुसना. So the malignant tumor will invade. It will not compress. It will invade and involve the surrounding tissue. Invade करके involve करता जाएगा. So there is a difference between compression and invasion. Compression यानी धकेलना और invasion यानी घुसना. Do you understand Hindi? I know only English and Hindi, two languages. Give me a thumbs up. Give me a thumbs up. You got it? You got it? So that is the biggest difference between them. Benign tumor compress the adjacent tissue. Malignant tumor invade the adjacent tissue. Give me a thumbs up here. Come on. So see the diagrams, the same diagram. You can see it is a benign tumor, well circumscribed, encapsulated. See it is a malignant tumor, irregular borders, irregular shape, non-circumscribed. So grossly you can see. Now we have seen the rate of growth. So benign versus malignant tumor. That is our topic, right? In benign versus malignant tumor, we have already seen the rate of growth. These are slow growing. These are fast growing. We have already seen that. Clinical features. Based on clinical features, we have already seen these are asymptomatic. These are symptomatic. We have already seen. Based on gross features. Based on gross features. These are spherical. These are irregular. These are covered with a capsule. Encapsulated, well circumscribed. These are non-covered with a capsule, non-capsulated. These compress the surrounding tissue. And these invade the surrounding tissue. Now let's start microscopy. The most difficult portion of this lecture is the 10 features on microscopy which differentiate benign versus malignant tumor. So let me start the microscopy. In microscopy, anaplasia differentiate benign and malignant tumor. It is the presence of anaplasia and malignant tumor that defines malignancy. If you want to say anything is malignant, you have to prove it is anaplastic. If it is anaplastic, then only you can call it malignant. Otherwise, you cannot call it malignant. It is benign. Give me a thumbs up. So what is anaplasia? What is anaplasia? Let me show you what is anaplasia. Anaplasia is these 10 features. Okay, let me define anaplasia. और detail में बताती हूँ. Anaplasia is lack of differentiation. Absence of differentiation is known as anaplasia. If differentiation is absent, anaplasia is present. So the two things are opposite. If tissue is losing differentiation, it is gaining anaplasia. So what do you mean by differentiation? You will say, ma'am, practically इसका मतलब क्या है? हिंदी में इसका क्या मतलब है? Students ask me that only, right? So what do you mean by differentiation? Let me explain you differentiation क्या होता है. Can you see? This is a tumor. Imagine it is skin. You can see it is skin is shown. So can you see these are the normal cells of the skin? These are normal cells of the skin this side. These are also normal cells of the skin this side. And in between, you can see the blue cells. These one I'm marking with red. These are cancer cells. So a cancer is developing in any organ. It is a skin, so it can develop in any organ. So these are the cancer cells. These all are cancer cells. So basically what we have to do, and these are the normal cells. These all are normal cells. Now compare the cancer cell morphology with normal cell morphology. Cancer cell are same as that of normal cell, or cancer cell are looking different from the normal cell. And if they are looking different, how much? Tell me the percentage, how much they are different. So that defines differentiation. What is differentiation? You can see here. What is differentiation? Differentiation is the resemblance of the cancer cell with the normal cell. How much cancer cell is resembling with the normal cell? Can you see here cancer cell is looking different? It is big, it is large as compared to normal cell. So shape is different, the size is different. See the nucleus, it is also bigger. Nucleus is different. So there are many differences between cancer cell and normal cell. They are not same. They are not same. So how much they are different? How much they are different? If both of them are different less than 25%, it is the tumor is known as well differentiated. If they are different 25 to 50%, the tumor is known as moderately differentiated. If they are different 50 to 75%, it is known as poorly differentiated. And if they are different 100%, all the cancer cells are different from normal cells. It is known as undifferentiated. So that is differentiation. So can I say lack of differentiation? If differentiation is absent, means the tumor is undifferentiated. It is known as anaplasia. So if differentiation is absent matlab resemblance is absent. There is no resemblance of the tumor cell with the normal cell. That is anaplasia. So that is anaplasia. Give me a thumbs up. I tried. At least I tried. So what is anaplasia? It is lack of differentiation. So what is differentiation? Lack of differentiation is anaplasia. So what is differentiation? Differentiation is the resemblance of the tumor cell with the cancer cell. If lack of differentiation is there, means there is no resemblance of the tumor cell with the normal cell. Tumor cell is absolutely different. So it is an anaplastic cell. Means it is a cancer cell. That defines malignancy. Give me a thumbs up. I tried. So that is the definition. Let me come on anaplasia. So anaplasia is basically lack of differentiation or lack of resemblance. One and the same thing. Resemblance. Because differentiation is known as resemblance. Anaplasia is the hallmark of malignant tumor. If you want to prove any tumor is not benign, it is malignant, you have to prove it is anaplastic. What are the features? These are the 10 features of anaplasia. Prove that 10 features in any tumor. If these 10 features are fitting in any tumor, in the slide of any tumor microscopically, that tumor is a malignant tumor, right? These features are not seen grossly by surgeons. Surgeons don't use microscopes. Microscopes are used by pathologists. So only a pathologist can see these 10 features on slide in microscopy. So it is the job of a pathologist to decide whether the tumor is benign or malignant, right? It is not a job of anyone else. So only a oncopathologist looking the slide will decide whether anaplasia is present or absent. Give me the thumbs up. Give me a thumbs up. Everyone give me a thumbs up. So let me proceed ahead. I will explain you all these 10 features in this diagram. So this is the best diagram where I can explain you anaplasia, right? I will take one by one. I will take all the features one by one. So let me enumerate the features. You can see the features one by one. Okay, basal polarity, pleomorphism, NC ratio, anisonucleosis, chromatin. Okay. So see, I will try. See, I will draw the mucosal cells here. So these are the mucosal cells. See, these are the normal mucosal cells. All these mucosal cells are normal. These are the normal mucosal cells. And let me draw the cells here. Let me draw the cells here also. I will draw the anaplastic cells here. So see, the first change, the first difference is the basal polarity. What do you mean by basal polarity? What do you mean by basal? Basal polarity का मतलब क्या होता है? In normal cell, what is the location of the nucleus? All the nucleus are towards the basement membrane. This is a basement membrane. So nucleus is never at the center. Normally, the nucleus is always towards the basement membrane. Always, it is not at the center. You can see all the nucleus at the basement membrane. This is known as basal polarity. Polarity matlab pole. The nucleus is present at a pole. Polarity. It is towards the base. It is north pole, south pole. So present towards the base. So basal polarity is present normally. But during anaplasia, during malignancy, during anaplasia or malignancy, the basal polarity is lost. So nucleus present anywhere. Nucleus is big and it is present anywhere. It is not necessary that it is always present towards the base. So basal polarity is lost in anaplasia. That is the first difference. Out of the 10 features, it is the first feature. Give me a thumbs up. So that is loss of basal polarity. See the location of the nucleus. Normally, nucleus is towards the base. Normally, the nucleus is towards the base. You can see the nucleus towards the basement membrane. But in anaplasia, it is haphazard. It is anywhere. So basal polarity, now on every point, give me one thumbs up. So basal polarity is lost. Basal polarity is lost in anaplasia. That is the first thing. Second feature which differentiate normal from anaplasia from malignant tissue is that pleomorphism. The second feature is pleomorphism. What is pleomorphism? Pleo means different, variation in shape and size. You can see normally all the cells are same shape, same size. They all are same shape, same size. So pleomorphism is absent normally. Normally the pleomorphism is absent. But in anaplasia, some cells are small, some are medium, some are large, some are small, some are medium. So pleomorphism is present. So in anaplasia, the basal polarity is lost and pleomorphism is present. So these are the two. Out of the 10, 2 are done. Out of the 10, 2 are done. Have you got it? So first is basal polarity. Normally basal polarity is present. But in neoplasia, in malignancy, it is lost. Normally pleomorphism is absent. In malignancy, it is gained. In anaplasia, it is gained. So we are done with 2. Out of the 10, 2 are done. Coming on the third one. The third one is the NC ratio. What do you mean by NC ratio? Nucleus cytoplasmic ratio. See NC ratio in both the cells. See the size of the nucleus here and size of the cytoplasm here. See the size of the nucleus here and size of the cytoplasm here. Here nucleus is small, cytoplasm is large normally. So numerator is less, denominator is more. So NC ratio is overall less. Normally NC ratio is very less. Normally. But in malignancy nucleus, can you see big nucleus are there. So numerator is increasing in size and less cytoplasm is there. It is covering the entire cytoplasm. So cytoplasm decreases. So numerator increases, denominator decreases. So NC ratio is more in malignancy. That is the third difference. Normally NC ratio is less. In malignancy it becomes more. That is the third difference. You can make it out. Give me a thumbs up. The fourth. Till now we are done with 3. Basal polarity, pleomorphism, NC ratio. You have to enumerate, huh? The fourth one. Basal polarity, pleomorphism, NC ratio के बाद चौथी चीज क्या है? What is the fourth one? The color of the nucleus. See the color of the nucleus. Here, normally the nucleus is light color. Light color मतलब होता है chroma. Chroma, the word chroma means color. Here nuclear is light color and here nucleus is dark color. Because in malignancy, the chromatin inside the nucleus become packed. The chromatin become crumpled. It become packed, which gives dark color to the nucleus, right? So hyperchroma. Hyper means more color. So where is hyperchroma present? Hyperchroma कहाँ है? Normally की malignancy. Hyperchroma is present in malignancy. Hyperchroma is absent normally. Hyper means more chroma. More chroma means more color. If you split the term now, you will never forget. वरना रटते ही रह जाओगे hyperchromatism. You will never understand what is hyperchromatism. Hyperchromatism is absent normally and present in malignancy. The meaning is the color of the nucleus. Chroma का मतलब होता है color. Hyper means more. So more color of the nucleus is absent and more color of the nucleus is present. That is the meaning. That is the fourth difference. Give me a thumbs up. Out of the 10, 4 are done. So basal polarity, pleomorphism, NC ratio, hyperchromatism. Give me a thumbs up. Everyone give me a thumbs up. Inside the nucleus, we have nucleoli. Nucleus के अंदर होते हैं nucleoli. Yes or no? So this is the nucleus. Okay. Inside the nucleus, we have dot-like structures, nucleoli. But nucleoli are absent normally. Normally, we can't see nucleoli inside the nucleus. But in tumor cells, inside the nucleus, multiple nucleoli are seen. So nucleoli. The next feature is nucleoli. Nucleoli is absent normally, but in malignancy, they are present. Multiple nucleoli are prominent inside the nucleus. Give me a thumbs up. So basal polarity, pleomorphism, NC ratio, hyperchromatism, and nucleoli. The number of the nucleoli, whether they are prominent or, give me a thumbs up. So out of the 10, we have done 5. Everyone give me a thumbs up. The next is the mitosis. माइटोसिस कहाँ ज्यादा होगा, नॉर्मली ज्यादा होगा कि मैलिग्नेंसी में ज्यादा होगा? ऑफ कोर्स द डिवाइडिंग सेल्स आर देयर इन द मैलिग्नेंसी, नॉट नॉर्मली. So you can see mitosis inside the nucleus. The nucleus is showing spindles, not normally, but here the nucleus will show spindles. So mitosis is absent normally and present in malignancy. Let me show these features, then I will continue. Okay, see these features. See, can you see this one is normal, and can you see this is malignancy? This is cancer. Cancer means malignant cancer. Compare the two. Please, everyone on your screens, compare the two. The first point is basal polarity. You tell me. See the nucleus here. See the basement membrane here. Here, see, this is the basement membrane. You can see the basement membrane here and see the basement membrane here. Now see the location of nucleus in all cells, where the nucleus is present. In the normal diagram, the nucleus is towards the basement membrane. Towards the basement membrane. So basal polarity is present here. But here, nucleus is present anywhere. So basal polarity is lost here. Give me a thumbs up. You got this point? Second point is pleomorphism. Pleomorphism. Second point is pleomorphism. Pleomorphism, here all cells are same shape and same size. Normally all cells, see, they are exact same size, exact same shape. So pleomorphism is absent here. But here some cells are small, some are medium, some are large. So pleomorphism is present here. Variation in shape and size. Give me a thumbs up. It is reverse of basal polarity. Malignancy mein basal polarity is absent, but pleomorphism is present. Give me a thumbs up. Talk about NC ratio. NC ratio here and NC ratio here. See the size of the nucleus here, all the nucleus ka size dekho, and see the size of the cytoplasm. So nucleus is less, cytoplasm is more. So NC ratio is overall less NC ratio. And here the nucleus is more and cytoplasm is less. So here numerator is more, denominator is less. So NC ratio is more. That is the third point. Give me a thumbs up. Everyone give me a thumbs up. Come on the fourth point. That is hyperchromatism. The fourth point is hyperchromatism. Hyperchromatism is present in malignancy and hyperchromatism is normal. The color is normal. The chromatin is normal. Here it is absent. Hyperchromatism is absent normally. It is present in malignancy. Give me a thumbs up. That is the color of the nucleus. The next point is nucleoli. Nucleoli. Can you see here in this diagram? Can you see here the nucleoli inside the nucleus? This is a cell. Cell के अंदर है nucleus और nucleus के अंदर देखो यहाँ पे भी. Here also you can see the nucleoli. So nucleoli are prominent in malignancy. They are absent normally. Normally I can't find nucleoli inside the nucleus. Give me a thumbs up. The next point which I have explained to you is mitosis. Mitotic figures. The mitosis. Mitosis. Can you find? Okay, see this cell. See, I'm marking. What I'm marking here in malignancy. See this one. See the nucleus. Inside the nucleus, can you see the spindles? Yes, you can see the spindles. So this cell is dividing. I can't find even a single spindle here. So mitosis is absent here, present here. Give me a thumbs up. That is the mitosis. That is the mitosis. The next point is the giant cells. Normally, there is no giant cell here. No, giant cells are absent here. But you can see a cell here. Can you see this purple cell I'm marking? This one. Count the number of nucleus. 1, 2, 3, 4, 5. 5 nucleus in one cell. So giant cells are a feature of malignancy. That is presence of giant cell. Give me a thumbs up. See the next one more point, cytoplasm. Normally cytoplasm color is normal. It is pink color cytoplasm. Color of cytoplasm is pink. But here it is light pink. The pink. Now compare the color of the cytoplasm both sides. It is light pink because of presence of mucin. So in the cytoplasm mucin is present. Give me a thumbs up. Give me a thumbs up. The one more last point that is I have left in between. Let me show you this point. N-isonucleosis. What do you mean by N-isonucleosis? का मतलब क्या होता है? Split the term. N-isonucleosis. N means, what does N mean? N means no. Iso means is equal to. Equal. Iso का मतलब होता है equal. Nucleosis means nucleus. Nucleus का size. Nucleus का size. Nucleus का size not equal. कौन सी तरफ nucleus का size not equal है? Where you can see nucleus का size not equal. Where you can see nucleus ka size. Here nucleus size is equal. All the nucleus size are equal here. So here anisonucleosis is absent. Here nucleus ka size is not equal. Some are big, some are medium, some are small. So anisonucleosis is present here. I hope I tried my best. I tried my best. Oh my God, I tried my best. Right? And the last is mutations. Of course, mutation means diploidy. Chromosomal diploidy is absent there. यहाँ पे सारे cells diploid होंगे. Diploid, that is no mutation. यहाँ पे aneuploidy is there because of mutation. Give me a thumbs up. Give me a thumbs up. Let me try. Who will tell me the 10 features? Who will tell me the 10 features? 1, 2, 3, 4, 5, 6, 7, 8, 9 and 10 features that differentiate normal tissue from anaplasia, from a malignant tissue. Please, everyone, please have. Okay, I will write the points. You just tell me which point is present where, which point is present normally, normally उस point का क्या है, and in malignancy what does that point has. And malignancy means anaplasia. So what is the definition of anaplasia? I will enumerate the points. Don't worry if you have trouble. The first point is basal polarity. You have to tell me what about basal polarity, where it is present, where it is absent. The first point is basal polarity. Second onwards, second point is pleomorphism. Pleomorphism is the shape and size of the complete cell. Now there are few points about the nucleus. Number one, nucleus ka color. What was that? Nucleus ka color hi tha na. Third is NC ratio. The fourth is hyperchromatism. The color of the nucleus, hyperchromatism. The next is size of the nucleus, anisonucleosis. The next is the nucleoli inside the nucleus. Nucleoli inside the nucleus. Next is mitosis inside the nucleus. Next is giant cells inside the nucleus, right? And next is cytoplasm ka color. Cytoplasm mein presence, absence, color. And last is ploidy and neuploidy ki diploidy. Ploidy. Now start answering. Who will answer it? Start answering. Please, I have filled the table. Come on. These are the differences between benign and malignant, you can say. Or else let me modify it. Just a second. Give me a minute. Let me see your chat where it is. Yes, I can see your chat. Let me modify. Let me tell you all these features in benign and malignant. Benign versus malignant. That is my today's chapter. Okay. Who will tell me the answers? Please write your answer. Basal polarity is present in benign and it is absent in malignancy. Give me a thumbs up if you are agree. Everyone give me a thumbs up. You know the meaning of basal polarity. That is the nucleus is towards the basement membrane. That is basal polarity. Give me a thumbs up. Come on. What about pleomorphism? What about pleomorphism? Pleomorphism में क्या है? Pleomorphism normally absent but present in malignancy. Present in malignancy. Pleomorphism is variation in shape and size. What about NC ratio? NC ratio normally it is low, but in malignancy the NC ratio is more. It increases because the size of the nucleus increases and cytoplasm decreases. So numerator is increasing, denominator is decreasing. Give me a thumbs up. Hyperchromatism. Chroma means color. Color of the nucleus. So hyperchromatism is absent here, present here. So nucleus is dark color here. That's why hyperchromatism is present. NC ratio is more because nucleus is increasing in size, cytoplasm is decreasing in size. You tell me the reason for everything. Why pleomorphism is present here? Why pleomorphism is present here? Because of variation in shape and size of all cells. All cells are different size. Some are small, some are medium, some are large. Right? So that is the reason. Anisonucleosis, N means no. Iso means is equal to. And nucleosis means nucleus ka size. So nucleus ka size is same here. That's why anisonucleosis is absent here but present here. Because here nucleus ka size is different. All cells have different size nucleus. Some has small, some has medium, some has large. Give me a thumbs up. Pleomorphism is cell का size और anisonucleosis is nucleus का size. यहाँ पे cell का size भी same है इसलिए absent और nucleus का size भी same है इसलिए absent. Cell का size में variation है तो it is present in malignancy. Nucleus के size में variation है तो present in malignancy. Both the features, the cell are small, medium, large. The nucleus is small, medium, large. That is pleomorphism and anisonucleosis. Both are features of malignancy, not benign tumors. Give me a thumbs up. Give me a thumbs up. What about nucleoli? Nucleoli are absent or not seen. Not seen in benign tumor. They are seen. They are prominent in malignant tumor. Nucleoli are present inside the nucleus. What about mitosis? Mitosis is absent in benign tumor. They are present in malignant tumor. Mitosis is seen in the form of spindles. In the nucleus, we can see the spindle formation. Spindle means dividing nucleus. Giant cells are absent in benign tumor. They are present in malignant tumor. Cytoplasm is normal pink color. In benign tumor, the cytoplasm is light color because of presence of mucin inside the cytoplasm. Polarity. Normally, benign cells are diploid and malignant tumors are aneuploid. I cannot simplify more than this. These are the limits. Give me a thumbs up. A big thumbs up. Everyone give me a thumbs up. Everyone means everyone. First give me a thumbs up. Have you got it? The differences between benign and malignant tumor. The 10 differences. You're not giving the thumbs up means you didn't got it, or you got it, you don't want to give the thumbs up. So these are the 10 differences. These are known as anaplasia. I will show you few figures. Can you see this figure? These are the real diagrams. See, all 10 features are absent here and all 10 features are present here. So this is anaplastic tissue. This is malignant tissue. So please read it. It is given in my notes. It is loss of polarity. It is pleomorphism. It is NC ratio, anisonucleosis, hyperchromatism, right? Nucleolar changes, mitotic changes, giant cells, right? So all the things, right? In this diagram, see, can you see a uterus here? Can you see a uterus here? You can see the two uterus of two females here. See, there is a tumor. The tumor is looking circle, spherical, well circumscribed, capsulated. Here also there is a tumor. The tumor is irregular in shape, haphazard, non-capsulated. Let's make a slide of this tumor. Let's make a slide of this tumor. The two slides are in front of you. You decide which tumor it is. The two slides are in front of you. In this slide, it is a benign tumor, and this slide, it is a malignant tumor. How I decided? I am a pathologist. I can see the changes. Okay, see what changes I have noticed. I have seen a giant cell here, which is absent there. I have seen few cells showing spindles. See, this is spindle forming cell. One more, there are few spindle forming cells. So this cell is showing mitosis, which is present here, absent there. Give me a thumbs up. All these cells, some are small, some are medium, some are large. So pleomorphism is present. Here all cells are equal. They are equal, pleomorphism is absent. See the nucleus. The nucleus is also different shape and different size. Here all the nucleus is same size. So anisonucleosis is absent there, present there, right? After that, I will see the basal polarity. After that, I will see what other features are. I will see all 10 features. So all 10 features are absent here and all 10 features are present here. That is, anaplasia is absent here and anaplasia is present here. So I will release my report. In my report, I will write it is a benign tumor. The name of the tumor is leiomyoma. See the suffix, it is oma. Leiomyoma, it is oma. And I will release my report. This tumor is leiomyosarcoma. See the suffix, it is malignant. So this one is benign, this one is malignant. So it is the job of pathologist who will decide whether the tumor is benign or malignant, whether it is leiomyoma or whether it is leiomyosarcoma. For a surgeon, both looks masses. For a surgeon, both are masses. Give me a thumbs up. Everyone give me a thumbs up. See, these are the real slides. You can see the cell. It is showing mitosis. Spindle formation you can see. See this cell, it is a giant cell. This one is a giant cell. Give me a thumbs up. This is a giant cell. See, these all cells are showing mitosis. See the spindle formation inside the cells. See, this is a giant cell. See, so we have done. Everyone give me a thumbs up. Everyone, if you give me the thumbs up, then only I will proceed to the next topic. Then only I will tell you further differences between benign and malignant. Then only I will tell you more differences between benign and malignant. Have you got it till now? Do you have any doubt till now? Yes? Okay. Let me teach you few more differences. Now, have you heard the three terms? Metaplasia, dysplasia and anaplasia. In anaplasia, I have told you the 10 features. What are the 10 features of anaplasia? So it is loss of polarity, it is pleomorphism, it is anisonucleosis, it is NC ratio, it is hyperchromatism, mitosis, giant cells, ploidy, cytoplasmic mucin. These 10 features define anaplasia, right? All these 10 features are present in dysplasia also. I'm saying all these 10 features are present in dysplasia also. So how you will differentiate dysplasia and anaplasia? The definition of both is same. It is also having the same 10 features. It is also having the same 10 features. The only difference, dysplasia is reversible, anaplasia is irreversible. Dysplasia is the precursor of anaplasia. First dysplasia occurs, the 10 features, but still they are reversible. Once they convert it into anaplasia, it is irreversible and it is malignancy. It is precursor of malignancy. Give me a thumbs up. What is metaplasia? Metaplasia is one of the cellular adaptation. If you know the 5 types of cellular adaptation, that is hypertrophy, hyperplasia, atrophy, metaplasia and dysplasia. So metaplasia, dysplasia, both are cellular adaptation. Metaplasia is transformation of one type of mature epithelia into another type of mature epithelia. If you know the adaptations, that is transformation of squamous to columnar or transformation of columnar to squamous. So it is a precursor of dysplasia. Okay, let me show you a diagram. So see the definition, I will show you the diagram, don't worry. Everything will be clear to you. So metaplasia, what is metaplasia? It is transformation of one lineage to another. So squamous get converted to columnar or vice versa, columnar get converted to squamous and it is reversible. Dysplasia are those 10 features, but it is partially reversible. And anaplasia is again those 10 features, it is irreversible. So that is the definition of the three. Now see this diagram, beautiful diagram. You can see, I will explain you this diagram. See, it is a tissue. It is any tissue. In this tissue, the epithelium is columnar. Can you see the columnar epithelium? And see the nucleus, basal polarity is maintained. It is a normal columnar tissue. Normal columnar tissue. In the second diagram, the columnar converted into squamous. So it is squamous. So what does this showing? This is normal. Let me say this one is normal, and let me say this one is metaplasia. Because the columnar get converted into squamous, still the tissue is normal. So normal got converted into metaplasia because the columnar epithelia converted into squamous. Do you have any doubt in this? No, you don't have. Now, those 10 features. What are the 10 features? Loss of polarity, hypertrimesm, anisonucleosis, mitosis, giant cell, whatever. Those 10 features, you know. Those started occurring from above to below. So see, from above to below. So this row is displaced, this row is showing those 10 features, this is showing, this is showing, this is showing. But these the below cells are normal. From upper to niche, from upwards below, the 10 features have started. That is dysplasia have started. The dysplasia have started. The 10 features started arriving from above to below. So dysplasia have started. The 10 features, but still it is reversible. That's why I'm not calling it anaplasia. I'm calling it as a dysplasia. So see, this is dysplasia. So normal got converted to metaplasia. Metaplasia got converted to dysplasia. Give me a thumbs up. Now in the next diagram, it become the, so it is started from above. Always it starts from above and it moves downward. So see, here only the above cells are dysplastic, the below cells are normal. But in this diagram, throughout the thickness, they all are dysplastic. The 10 features is present throughout. So the 10 features, loss of polarity, hyperchromatism, mitosis, it is present from the first row till the last row. So it is full thickness dysplasia. Basically, it is full thickness dysplasia. The full thickness dysplasia is known as carcinoma in situ. It is carcinoma in situ. That is full thickness dysplasia. Give me a thumbs up. Now the fifth diagram is not drawn here. You draw the fifth diagram. Now what's next? What's next? Till now, what is the scenario? What's the last diagram? All the cells are dysplastic from the first row till last row. But in the last row, this is the basement membrane. See, the basement membrane is intact. The dysplastic cells are present inside the basement membrane. They have not breached the basement membrane. Now these abnormal dysplastic cell, they will breach the basement membrane and come below. They come below. Once they come below, it is known as anaplasia. It is known as anaplasia and it is malignancy and it is irreversible. It is irreversible. Give me a thumbs up. So what is the summary? Initially, first there is normal. Normal leads to metaplasia. Metaplasia leads to dysplasia. Dysplasia leads to full thickness dysplasia, which is known as carcinoma in situ. And once, till now the basement membrane is normal. Now the basement membrane is breached. It is broken down and the dysplastic cells will move down and it is known as anaplasia. Anaplasia is malignancy and it is irreversible. Everyone give me a thumbs up. Everyone. So can I say dysplasia or carcinoma in situ? These are the precursors of malignancy. These are the precursors of anaplasia. If you got this, everyone give me a thumbs up. Everyone means everyone. So can you differentiate the three? So metaplasia is always reversible. Dysplasia is also reversible. Anaplasia is malignancy and it is irreversible. The 10 features are present here also, here also. Give me a thumbs up. Everyone give me a thumbs up. What you are asking? Whenever anaplasia occur, it is always preceded by dysplasia. Yes, always preceded by dysplasia. So dysplasia is a precursor of anaplasia. Dysplasia is not malignancy. It is pre-malignancy. So can I say it is benign? Still it is benign. It is going to convert into malignancy. And anaplasia is malignancy. So that is the thing. Have you got it? So first the cell will become dysplastic, then only it will convert into anaplasia. So we have seen the differences between benign and malignant tumor. Let me enumerate the differences. Who will help me in enumerating the differences? Till now, there are few more differences I will tell you, but see, till now, abhi tak ke kitne differences hain, let me enumerate. So benign tumor, malignant tumor. We have two types of tumor, the benign tumor, the malignant tumor. Let me tell you the differences. The benign tumor, tell me the gross differences, the clinical feature differences, tell me the growth rate, tell me the microscopic, the 10 microscopic features, tell me local invasion and distant invasion, that is metastasis, tell me the prognosis. So these are the headings under which you have to differentiate the benign tumor from the malignant tumor. That is my present topic, benign versus malignant. This is the summary. Don't learn, understand this table. Now you yourself can make it out. You yourself, no need to learn. So tell me the boundaries. Benign tumors are encapsulated. These are non-capsulated. Benign tumors are well circumscribed. These are non-circumscribed. These are irregular, right? सराउंडिंग टिश्यू को बिनाइन ट्यूमर कॉम्प्रेस यानी दबाएंगे, पुश करेंगे, द मैलिग्नेंट ट्यूमर इन्वेड, ये उसके अंदर घुस जाएंगे. सो बिनाइन ट्यूमर कॉम्प्रेस द सराउंडिंग टिश्यू, मैलिग्नेंट ट्यूमर इन्वेड द सराउंडिंग टिश्यू. बिनाइन ट्यूमर उसको धकेलेंगे, इन्वेड ट्यूमर उसके अंदर घुस जाएंगे. गिव मी अ थम्स अप, गिव मी अ थम्स अप. साइज, बिनाइन ट्यूमर्स आर यूजुअली स्मॉल, मैलिग्नेंट ट्यूमर्स आर यूजुअली लार्ज. secondary changes. Benign tumors में नहीं होंगे, malignant tumor will have secondary changes. The microscopy, you know the 10 microscopic features. The 10 microscopic features, that is loss of basal polarity, pleomorphism, NC ratio, anisonucleosis, hypertraumatism, mitosis, giant cells, chromosomal abnormality, all these. I have already explained what is about benign, what is about malignant. I am not repeating it. You already know the 10 differences that are mainly deciding whether it is benign or malignant. Give me a thumbs up if you know it. Everyone give me a thumbs up. Everyone give me a thumbs up. Growth rate. Benign tumors are slow growing. Doubling rate is more. Malignant tumors are rapid growing, fast growing. The doubling rate is less. Give me a thumbs up. Prognosis is good here in benign. Prognosis is poor. Death occurs by complication, by metastasis. Right? The two things, that is local invasion and metastasis, both these things are absent in benign and both these things are present in malignant. Everyone give me a thumbs up. I cannot simplify than this. You want me to revise these 10 points again, or you got it? This is anaplasia. So basically anaplasia is present in malignancy and anaplasia is absent in benign. Everyone, these 10 points are known as anaplasia. Loss of differentiation is known as anaplasia. I want thumbs up from everyone, means each and every one of you. Those who is listening, who is not deaf, who is not dumb, and who is not sleeping, please give a thumbs up and you got my point. And if you have any doubt, please write it down. Have you got it? So Stephen, Samba, Akhilesh, Zed, you all have given the thumbs up. Thank you for responding. So let me proceed ahead. Let me see if I can see the chat. Just a second. Yes, I can see the chat. So these are the differences between benign and malignant tumors. We have covered beautifully. I guess we have covered beautifully. I would like to launch some polls. In the polls, I will launch the MCQs which are already asked in the previous year question papers of NEET PG, FMG and INICT. You have to write your answer in the chat box. So the first question is in front of you. I'm waiting for your answer. I want to see who is first. Who's first? So please write down your answer in the chat box. Please. What is lack of differentiation known as? Lack of differentiation is known as anaplasia, dysplasia, metaplasia or hyperplasia. All are plasia. So what is the correct answer? Yes, Akhilesh, Stephen. What is the correct answer? Zed, Rakesh, Bablu, Sheikh. Anyone who want to give me the answer? So Zed, you have given the correct answer. What about others? Please everyone give it a try. At max you will be wrong, but give it a try. No? What is lack of differentiation known as? So lack of differentiation is anaplasia. I have already explained you. Yes, Vinay Kumar. The lack of differentiation is anaplasia. You know what is differentiation? Differentiation is the resemblance with the normal tissue. If the tumor cells are not resembling with the normal tissue, that is lack of resemblance is there. It is anaplasia, and anaplasia is the hallmark of malignancy. The 10 features define anaplasia. You already know the 10 features. I have enumerated many times. Yes, very good, Akhilesh. Very good. So the correct answer here is A, and you all are right. Coming to the next question. Now the question is tricky. I am warning you, the question is tricky, so don't rush. Read it carefully. Just give a thought, then write your answer. Don't rush. What I am saying in the question, reversible loss of polarity and abnormality in size, abnormality in shape is known as. Reversible loss, I am saying 3 features. Loss of polarity, variation in size, variation in shape. So loss of polarity and pleomorphism. These are features of which thing? I have told you 10 points of anaplasia now. So these are the points of metaplasia, ki dysplasia, ki anaplasia, ki hyperplasia. These are the points of which? Yes, Zed, you are right. I guess you got the clinch in the question. There is a clinch in the question. Now I have told you those 10 points are present in dysplasia also, and those 10 points are present in anaplasia also. So these both points, that is loss of polarity and pleomorphism, they are present in dysplasia and anaplasia both. Now the clinch in the question lies in the word reversible. So dysplasia is reversible and anaplasia is irreversible. So since the examiner is asking reversible, my answer is B. Yes, Akhilesh, you are also right. Vinay Kumar, you are also right. In the same question, if I am changing the question, instead of reversible, I am asking irreversible. What is your answer now? Now your answer will become D. Now your answer will become D if I am changing the question and doing it irreversible. Have you got it? Have you got my concept? Have you got my concept? Yes. So correct answer here is B. Okay, this is the next question. How you differentiate carcinoma in situ from invasive carcinoma? The last 2 diagrams. So first there was normal, then metaplasia, then dysplasia, then carcinoma in situ, and then carcinoma. How you differentiate the two? How? Which features will differentiate the carcinoma in situ from carcinoma, invasive carcinoma? Is it penetration of the basement membrane? Is it number of mitosis? Is it metastasis? Or is it nuclear pleomorphism? What does differentiate? Yes, penetration of the basement membrane. So in carcinoma in situ, you can see in carcinoma in situ is full thickness dysplasia. So all the cells from the first row till last row, all the cells are dysplastic, but see, the basement membrane is intact. And once the basement membrane is intact, the cells come down, it is breach in the basement membrane, it is known as carcinoma. Yes, Stephen, Z, Akhilesh, you all are right. The correct answer here is A. This is the next question in front of you. Earliest change towards neoplastic transformation at microscopic level. How it is seen, what it is known as. Earliest change towards neo. You know the complete sequence now. First it is normal, then it is metaplasia, then it is dysplasia, then it is known as carcinoma in situ, then it is carcinoma. So what is the earliest change? What is the earliest change? Is it hyperplasia? Is it metaplasia? Is it dysplasia? Or is it carcinoma in situ? What is the earliest change? I want to see what you are saying. So you know the complete sequence. You know the complete sequence. Now what is the answer? Now most of you, okay. So the correct answer, yes, that you are right. The earliest feature at microscopic level is dysplasia, which is the precursor of the malignancy. Yes. So yes, Akhilesh, I want you to write B. I want someone to write B. B is not the correct answer. B is not the correct answer. I know technically you will say कि मैम सबसे पहले तो metaplasia ही आ रहा है ना. You are saying first there is normal, then there is metaplasia, then there is dysplasia, then there is carcinoma in situ, and then there is carcinoma. So this is the sequence, and you are asking the earliest. So technically speaking, yes, Akhilesh, you are right that technically it is metaplasia. So technically it is metaplasia. Technically it is metaplasia, but but at microscopic level, we can't call it as neoplastic transformation. The neoplastic transformation starts as dysplasia. So the correct answer here is dysplasia, not metaplasia. You got my point. So thank you very much. I would like to stop here. I hope you have learned a lot in today's lecture. We have covered the differences between benign and malignant tumors up to an extent. And thank you very much for being with me. And don't forget to write your feedback in the comment box. Your feedback is really very important for me. Whatever is your feedback, whatever you feel like, any suggestions, please write down. Any other topic you want from my side in the free YouTube classes, please let me know. So thank you very much. The next class will be tomorrow. Every day I take 3 to 4 hours on the YouTube. Today also in the evening at 7 o'clock, I am having a free YouTube class in which I am going to teach you the steps of the metastasis. I'm going to teach you the details of the metastasis and genetic regulators of the carcinogenesis, right, of the malignancy. So please attend that. If you like the lecture, don't forget to click on the like button, share with your friends, colleagues. Don't forget to subscribe our YouTube channel, that is Let's Crack NEET PG and Unacademy Future Doctors, and press on the bell icon for getting the notification. If you take the paid subscription of Unacademy, these are the various features the team is offering you, the new offerings, right? Now on the app, previous year question papers are available for your practice. You can do the practice of NEET PG, FMG and INICET 3-year question papers previous year. Extensive doubt solving batches there. You can ask your slightest doubt in any of the 19 subjects to your educator. We are there to answer your doubt in doubt clarification batch once you take the subscription. And after every plus class, we will give you a bunch of 5 to 10 questions to practice, right? So these all features are already available on the app. Unacademy Lite is already launched. In Unacademy Lite, you can take the test series of the NEET PG. You can subscribe for that. So the biggest announcement is that today, 31st March, till 12 a.m. in the night, the offer valids. This is the biggest end of year sale, right? Instead of 10% discount, you will get 20% discount on all the subscription if you apply my code. My code is my surname, Sachdev, SACHDEV, Sachdev 10 is the code, right? So thank you very much for being with me. And once you take the subscription, you will be eligible for all these batches from topmost educators of the India. Thank you very much.